Hi, I'm Mina Malik Hussain, and this is the coffee table. Sometimes I feel like I should have a little drum roll situation, but it's not that kind of show. May, as you may or may know, is Lupus Awareness Month, and the color for lupus awareness is purple. And it's surprising that millions of people around the world suffer from the autoimmune disease that is called lupus, and a lot of people in Pakistan have it. And somehow we don't really talk about it, and we don't really know what it means to live with a lupus diagnosis. What is it exactly, like other than an autoimmune disease? Even I wasn't very familiar with the complications and the implications of what it means to have a lupus diagnosis and how to manage it through your life. The good thing is that we have two extremely talented rheumatologists joining us on the show to explain the situation and to give us some, sort of really useful information and just, do some myth busting and just, I'm looking forward to a really cool conversation about lupus. Only on the coffee table can we could have that kind of sentence. Anyway, I digress. We are so excited to be welcoming back on the show Professor Dr. Nigat Ahmed, who is an award-winning consultant rheumatologist based in Lahore. She is the chair of the Department of Rheumatology at National Hospital and Medical Center. She is the director of the Arthritis Care Center. She is the faculty chair at Fatma Jinnah Medical University in rheumatology, of course, and the chair and founder trustee of the Arthritis Care Foundation, which provides patient care to the needy and education and training to medical professionals in rheumatology. And also joining us today is Dr. Shakaib Qureshi, who is also a consultant rheumatologist based here in Lahore, where he sees patients at the Genesis Clinic. He is the director of rheumatology at UBMC in Roosevelt, Utah, and an associate professor at the Roxy Vista Medical College, also in Utah. He is the former chair of rheumatology at Christian Care Healthcare Center in Delaware. And both doctors extremely talented, and we are so happy to have you both on the show. Both of them are currently based in the US, where they have given us time across time and time differences and polishing up their skills to come and talk to us. Welcome to the show, doctors. So let's begin at the beginning, as I like to do. And Dr. Nigat, what is lupus?
Lupus is derived from a Latin word, which means wolf.
Oh.
And it was described by a physician in 13th century. Can you imagine when you trace back the history?
Wow.
And his name was Rodriguez.
Huh.
And the name wolf was given to it because the lesions of lupus on the skin sometimes can be so severe, and the scarring due to it, that he likened it to a wolf bite.
Oh.
So that was pretty scary because as it affects the skin in multiple ways, one of the worst possible ways is having a lupus, problem with the skin, which could look like a bite of a wolf. But then it's a long journey. Then finally a physician by the name of Qureshi thought and then wrote that this is not only a disease which is limited to the skin, so it can affect any organ system of the body. So it's a great mimicker. That's why, the diagnosis is missed. Even, in United States, it takes about average of 5 to 6 years
for pin it
for
down.
A patient to get that. Yeah, exactly, because they can affect. The patient can present with pneumonia in a pulmonology clinic. He can present with a stroke. He or she can present with a stroke. They can, affect the eyes, the skin, the joints, arthritis, everything possible can happen. And that's why the diagnosis is missed. And that's a tragedy because 9 out of 10 patients are young women of childbearing age. And that is why this is so close to my heart, because being a woman, and I know having, children, if the mother is sick with lupus, or if the mother is pregnant with that first child, because it can affect any age. Even babies can have lupus. So it is a disease.
Wow, that's something to cycle back to in a minute. Babies having diseases is always terrifying. But Before we get to that, Dr. Shakaib, like Dr. Mir just said, 9 out of 10 people who have lupus are women. So clearly women are more likely to be diagnosed with lupus. But I don't think that, can you catch lupus? Like, how does it happen?
Bismillah ar-Rahman ar-Rahim. Yeah, so lupus, as Dr. Nigat gave a very good introduction, is a pretty elusive disease in that sense that not only there is a confusion amongst the general doctors of what lupus is, but many a time it's very difficult for the rheumatologist to come to a consensus too.
Oh.
Sometimes it's very easy to diagnose just because it's a very clear-cut presentation. For example, lupus affecting the kidneys is the main problem.
Okay.
It's very well known to affect the organs as well as, the skin, as she just described. We really worry about when it starts affecting the organs. For example, somebody presenting with lupus nephritis, which is inflammation of the kidneys, that is more of an emergency or urgency at least. And similarly, if it affects the brain, that's an emergency or urgency. Also, it can affect the lining of the heart and the lungs. And we'll describe all that in a second. But where it becomes actually difficult to diagnose is that it can be very subtle in presentation sometimes when it's only affecting the joints and the skin. And because there are a lot of other things which can mimic that too. For example, she just mentioned about a skin rash and a great mimicker. The skin rash, the acute rash of lupus, which is called a butterfly rash or a Miller rash, actually mimics another thing which is also pretty common called rosacea.
Yes.
So if you have a blood test positivity,
red patches on the face.
So there are so many, terrible misdiagnoses that I've seen where, a general doctor or someone who does not know much about it can make the diagnosis of rosacea as lupus if only preliminary blood test called ANA is positive.
Yes.
So that's where we get into a problem.
Yeah.
The age range definitely, it's younger females. It can actually affect very young kids too.
Right.
I've seen kids like as young as 12 years old. Wow. Similarly, it can also present in old age, but luckily speaking, the old age is not that common as other illnesses. But the highest incidence is somewhere between the age of 18 to 40, 42. And yes, the female population is like, different studies mention like 1 to 7 ratio, 7 to 1 ratio of female to males up to about 15 to 1, 15 to 1 or 20 to 1, depending upon what age range you catch. So yes, it definitely affects the females.
And that's a very concerning age range also, because if we're looking from, let's say, sort of mid-teenage to mid-40s, that's the prime of your life to be managing something like that. So, Dr. Nigat, if one finally does arrive at a diagnosis of lupus, can lupus be cured?
Can I say something?
Yes.
As Dr. Shakaib very rightly pointed out, I think treatments before that, I think we need to educate our physicians. We need to educate all specialists. So there should be a rheumatology for subspecialists, because patients can sometimes be presenting to a very good dermatologist and the diagnosis can be missed for years. Because it happened to some of my patients, they can be, not because they are excellent dermatologists, but some people don't know that it can affect the kidneys silently, and you can come to know about it when sometimes they are in renal failure. These young women, children, and even men. So it is so important that the nephrologist should also know. If there is treatment for it, there is treatment for it, because a 95% survival rate, 95% means, with correct diagnosis, timely treatment, timely referral to rheumatologists. Because I am a strong believer of this, that, for correct treatment, primary physicians and people who see these patients should immediately refer them to rheumatologists, because it's a very specialized treatment. It can't be done by best of physicians. So I clearly say that because it is a field which has rapidly advanced in the past decade. And as I said, people can lead normal lives. They can get married. They can have children if they are taken care of by rheumatologists.
So it has to be managed. It has to be managed correctly by a specialist. So
yes.
let's say that somebody actually has lupus, but they think that they have, let's say, kidney trouble. So if you're treating for what you think is kidney trouble or inflammation, that treatment is not the same treatment as a lupus treatment, correct? So even if you're treating the wrong, yes, I think that's the question. What I'm saying is that you can't control, or you can't manage lupus even if you're accidentally managing the disease you don't actually have. I think it's a very awkwardly phrased question, but I hope you know what I mean.
I think the most important thing is this, that diagnosis of rheumatic diseases is based on a correct history, spending time with the patient, doing the correct examination, and you arrive at a diagnosis after, taking all this. But then there are special tests which are done in special labs.
Yes.
And if everything put together, then you know that you're treating lupus. So the patients, when they can present to a very good nephrologist and he can just detect some abnormal urine in there and some blood pressure, the diagnosis may be missed for a while because they need an immediate kidney biopsy, renal biopsy to determine what type of renal involvement they have. And some of them need very aggressive treatment for involvement of the kidneys, which, so rheumatologist is the pillar.
Yes.
And he is supposed to get in touch with the relevant specialists like skin, like, nephrology for a biopsy. Or so pillar, I think, and
or the sort of, the general.
Will agree with me.
You're going to direct the other troops there. Okay, nephrologist, dermatologist, go. So, Dr. Shakaib, what different kinds of lupus are there? We've been talking about kidney-related lupus, but I do understand that there are different kinds as well.
Different kinds, basically. The lupus is actually lupus. There's not a different kinds, but there is a different ways it can present.
Yes.
For example, one of the important components, which we can see externally is the skin manifestation.
Right.
So skin lupus itself can be of so many different kinds. For example, there's an acute lupus rash. There is a subacute lupus rash. Then there is a discoid rash.
Yes.
And then there are so many other rashes which can be related to lupus, but mostly not systemic lupus.
Yes.
For example, there is lupus profundus rash, and so on and so forth, which become pretty rare to diagnose. But the main hallmark is, for example, the mallow rash, which is like a butterfly rash in the distribution around the cheek area. And then lupus can pick and choose how it
Yes. It manifests in different ways.
That's why the systemic lupus is where, the other systems get involved. For example, skin might just be an external manifestation. But then the next step is that we have to risk stratify. We have to take a very detailed history from the patient and do a very careful physical examination so that we are not missing the very important and the very serious potential organ-threatening lupus. And that's where the art of practicing rheumatology comes to a very experienced person where they're not missing anything. As I told you unofficially before we started, that the overdiagnosis and underdiagnosis of lupus both are extremely common. Because to a general person, just a rash and a positive ANA may be lupus. And I've seen half of the time that's not true. And they get treated for lupus without a reason to be treated for lupus.
Right.
And then there are people where you just miss them for years and years, as Dr. Nigat mentioned, and they may end up being very sick.
Yes. So what happens if you underdiagnose lupus? If your lupus goes, well, either way, actually. So if you get overdiagnosed and you begin treatment for lupus, how would that affect the body?
Well, let's take the example of overdiagnosis.
Yes.
I had a patient presented to me in Pakistan who actually had a malar rash and he had an ANA positivity. And somebody put him on methotrexate. So this was an error at multiple levels. For example, first of all, ANA is a very non-specific test. It's just a screening test. It's highly sensitive, but very non-specific. Okay, so it can be used for screening purposes, but not diagnostic purposes.
Oh, okay.
That particular
so it's just an indicator.
And that particular person has rosacea, and did not have lupus, because when clinically he did not look like lupus. And then when I ordered the further testing, which we call ENA, which are more specific autoantibodies, they came all back negative. And the dose of methotrexate, unfortunately, was not also given correctly. And even if he had skin lupus, I would not have started him on methotrexate right off the bat. So this is how you can go wrong, and potentially a life-threatening medication can be given for a very simple misdiagnosis,
Oh gosh, so it'd be life-threatening to receive the wrong medication, and that's why overdiagnosis is a problem, and obviously clearly dangerous thing to do.
So you're absolutely correct. Like if you make a wrong diagnosis and then give a wrong dose of medication, the medications used for lupus some of them are potentially life-threatening if you don't know what you're doing.
Yeah. No, you're absolutely right. We're going to take a very quick break here, come back to misdiagnosis of lupus. It's a somber note, but suspense and all. Stay with us. We'll be back in a minute. Welcome back to the coffee table, where we are engrossed in a fascinating conversation about lupus, which is actually a really ancient disease. Sounded like a fancy new one because of the autoimmune component, but clearly not. We are talking to rheumatologist extraordinaire, Professor Dr. Nigat Mir Ahmed and Dr. Shakaib Qureshi, all about lupus. I feel like I might be sounding a little flippant about it, but it's actually really fascinating to sort of dissect this disease. And before the break, we were talking about overdiagnosing lupus, but there's also misdiagnosis. And I know that rheumatologists have many feelings about about misdiagnosed patients. And like you said, Dr. Nigat, rheumatology is still a developing field in Pakistan, and that's why a lot of people have these rheumatological conditions but get treatment too late. So you said that 95% of people with a diagnosis of lupus have a very healthy and very normal life expectancy and can live a perfectly normal life as long as they continue treatment. So what are the kind of average treatments that people with lupus need to be undergoing? So I'm also thinking about this from a living in Pakistan perspective also, like there's medication, is there therapy, a healthy lifestyle, things like that can help you manage your lupus?
I have to mention two most important things.
Yes.
I think we need to have human resource. So the journey has been very long. I have to mention that.
Yes.
Pakistan Society of Rheumatology played a very positive role. And then, we were like 10 in number, and now we are almost like 80, 90 in number. So in Pakistan, which is well below what is needed. But
better than
anyone to say that we could not refer a patient to a rheumatologist, I cannot buy that. Because even if they have to wait for 6 months because they can't access to a rheumatologist, it's better than to be treated by best of specialists. So the first important thing in treatment is the right diagnosis that Dr. Shakaib mentioned, because the test which is done, which is anti-nuclear antibody test, can be present in malignancy, it can be present in infections, it can be drug-induced. So you cannot start treatment just based on one single test. It is like if you have fever and you go to a specialist and he says, okay, I think you have typhoid, let's give him antibiotics. Not like that. So ANA is like having fever and you have to dig out the cause, what is it really true lupus? So the first and foremost treatment is going to be successful only if you are with the right person and at the right time. So the medicines, I will give this message to patients and to doctors that some of the times we have to use steroids for this treatment, which is very traumatic for young women. They are so much worried about their looks and their weight and acne and the problems with that. But most of the time we end up using that in life-threatening situations and sometimes in small doses for flare-ups.
You're right.
The person who discovered this, Hench, he got a Nobel Prize because of this discovery.
Wow.
So if it is used by the right people at the right time, this is life-saving. So basically, the mainstay of treatment sometimes would be just steroids.
Right.
I know we lost a very the first patient I had treated in Pakistan. When I came back after 2 years, she left treatment. And when I saw her, she had developed fever and she was under care in a hospital for diagnosis of fever. 1 month later, they discovered that she did have lupus 2 years ago, and she died with a little baby who was 3 years old. Because the education of patients, education of physicians is very, very important. Very good, as I said, very good specialists with good intentions. This is a very difficult disease. It has several phases. So,
and I'm glad that you mentioned cycles, because that is what managed lupus doesn't it? Is that it's under control, but then you have a flare-up. And do you think that a lot of patients then might stop treatment because they think that it's under control or that it's gone away or they're cured now? Is it possible for lupus to be sort of entirely just cured? Can it just go away?
It is not curable. It stays there. There'll be flare-ups. There will be remissions. Yeah, people can get free periods but they still have to be under care because it can flare up anytime. So sometimes, young children, young women, they're fed up of taking medicine, and sometimes they think they're doing so good, so let's stop it. Yeah. But that cannot happen unless their doctor or their rheumatologist stops it. So, most of the time they have to be on medication. One of them is hydroxychloroquine, which they have to be on probably as one of the leaders in rheumatology, lupus. Michelle Petrie says in John Hopkins, because she has following her patients for 30, 40 years now, that once on hydroxychloroquine, they probably will have to take hydroxychloroquine for the rest of their life.
Right.
And
but as long as they keep doing it, they'll have a healthy, happy, long life. But you just have to keep doing it. Keep following your treatment.
Yes, always. Not leave it unless there's a reason for it.
So I'm also
lupus specialty itself.
Quite right. Because it is sounding so complicated that it seems like something that is still sort of, one is unraveling the mysteries of the disease. So, Dr. Shakaib, is there any reason why so many women get lupus more than men? Do you think the genetics plays a role there? Are there genetic tendencies for certain people to get to sort of come down with lupus? Does family history count? Are those factors?
Good question, in fact, because, when we try to find out pathophysiology of a disease, mostly autoimmune diseases are very difficult to kind of find the real cause. But there are studies to show that there is a genetic component, and there are about 100 polymorphisms that they've been kind of, focusing on the genetic disorders or genes where they have find out that maybe if you have them, then you have more chances that you will have lupus. And X chromosome may actually play a very important role. And therefore, they have seen actually that even in the males who have an extra X chromosome, such as Klinefelter syndrome, they may actually have a higher chance of having lupus. So yes, definitely genetic component. And then the hormonal component. Why do the females have more at the childbearing ages? Because estrogen can potentially, trigger the causation and then worsening of the disease itself. And that's why, in fact, one of the questions you could ask from us in the interview is that if you have, the pregnancy in lupus, that's the most important part. Yeah. Because in Pakistan, that is probably the most sensitive question. And how to prevent a pregnancy, because prevention of pregnancy and using the contraception is as important of a question as managing the lupus during pregnancy.
Yes, that was indeed going to be my next question because we're talking about estrogen and we're talking about hormones, and contraceptive pills are all about managing hormones as well. So if you have a diagnosis and you are a young woman of childbearing age, a woman of childbearing age, then how does one manage that? Because I think, obviously, if you're a certain age, then childbearing is a concern for lots of women who want to have children or already have one. And I know that neonatal lupus is also a thing. So what does one do?
Tell you about that pregnancy and lupus. It's a very sensitive topic in women of childbearing age. And that's one of the reasons actually girls can get depressed and the whole family gets involved psychologically too. Because let's say a girl gets diagnosed of lupus before she's married or wants to have a pregnancy, then the main goal is to control the lupus serologically and clinically, at least for 6 months to a year. And there are so many technical parameters, which will probably be not the main focus of discussion here for the public. But we have to get them clinically and serologically under remission for 1 year, at least 6 months to a year before they can attempt a pregnancy. And then to manage the pregnancy throughout, the lupus throughout the pregnancy is another challenge because pregnancy has a high estrogen state. So lupus and estrogens are not friendly. And so the pregnant woman is very commonly at risk of having a lupus flare. And a lot of medication that we can use for lupus, otherwise, especially for organ-threatening lupus, may become contraindicated during the pregnancy.
Yes.
And many of the manifestations of lupus flare can be due to a pregnancy complication as well. So it has to be very closely managed. That's the thing. And then there are certain autoantibodies such as anti-Rho and anti-La antibody, also called SSA and SSB, which are very high risk for neonatal lupus. And neonatal lupus can be of different kinds. For example, those particular antibodies can cross the placenta and can affect the fetal heart. So it also is very important if you have those antibodies to have serial echocardiogram and ultrasound done starting at the age of 18, starting at the week 18 up to like week 26 or longer, depending upon the clinical situation, to make sure that the fetus is not developing any heart blocks or heart failure. And then when the kid is born, the neonate is born, at that time to make sure that he's not having a neonatal lupus, which can range anywhere from a skin rash to heart block and heart failure. So that is the main important part. And the second question is about contraception. So contraception plays a very important role when you have completed a pregnancy or you want to prevent a lupus pregnancy while lupus is being controlled. And as we know, a lot of contraception involves, most of the contraceptive pills can have estrogens in them. So that is the very important role. The expert opinion has to be sought for, like how to use a proper contraception. And that's a whole separate topic of itself.
So Dr. Nigat, how likely is it that a woman with a lupus diagnosis will have a baby that will have lupus? Because I think that's probably one of the most major concerns that somebody with lupus who wants to have a baby would be thinking about. Is it statistically really likely?
Yes, it is, because they have a higher chance, especially, lupus twin pregnancies where twins have lupus. So there is like a 5%, 1 to 5% chance of the baby having the lupus. It's not very high though.
It's not very high.
But it runs in families. And Asians have more severe disease. And pregnant women.
It's more common. Oh, goodness. We're going to take a very quick break here while I mull this over. We'll be back in a flash. Stay with us. Welcome back to the coffee table, where we are having a riveting conversation about the disease lupus with rheumatologist Professor Dr. Nigat Mir Ahmed and Dr. Shakaib Qureshi. Now, before the break, we were talking about how certain people are more prone to getting lupus, such as Asians. So if we're looking at more women are diagnosed with it and Asians are prone to it, then Dr. Nigat, how come we don't have more statistics about lupus in Pakistan? Like on the website, on the internet, I've been reading about lupus, and I know that there's a Lupus Foundation of America, and they have these wonderful statistics and information and help for families and people who have a diagnosis. But there just doesn't seem to be any conversation about lupus diagnoses in Pakistan. And why is that?
So in Pakistan, unfortunately, we are lagging behind with our statistics. And this time that we have our own prevalence, we all know that 1.5 million people, in USA have lupus. So Asians have more severe lupus. They have more severe disease. Right. So
why do you think that
we
is?
are lagging behind. But we also have lupus. We also have Arthritis Care Foundation because their treatment is very expensive. So a person's expense can range from like 20 to 30,000 per month, leaving alone the tests. Especially women with nephritis, kidney involvement. They want to get pregnant. They want to, they're. So the main focus of a young woman is to get married, have healthy children, and get off the medicines. So for that purpose, we used to have injections, which we used to use, which were, there was a risk of not being able to have a child with those injections. They were very cheap, but we stopped using them because we said, okay, let's use other medicines so that they have a chance to become pregnant. So yes, you're right, but the foundation, Arthritis Care Foundation, does help a lot with treatment of lupus patients. And recently, we joined Central Park Medical College, and there are free beds in most of the hospitals. There are rheumatology beds in King Edward, in Sheikh Zayed, in Central Park, in Fatma Memorial. But medication is very expensive.
And so it is expensive, And I feel like there's also that inevitable reality that a lot of patients can't afford the treatment, and also historically, and this is not just Pakistan but all over the world, women do not receive consistent and high quality medical attention in any case. So that complicates things further, because outside of pregnancy or having babies, do you think that a lot of women just don't receive treatment even when they have a diagnosis?
Of course, a lot of women don't receive any treatment because there are issues with their, not only economics, it's family issues. Because if if it's the husband who has to understand that his newly married couple cannot have a baby, they cannot have a baby till, just like Dr. Shakaib mentioned, till their disease is controlled for at least a year, or 6 months. So that's very hard and very tough for women here. And not over here, but all over the world, but especially with us, because a newly married couple must have a baby in a year.
Within a year.
There's no way. So they'll say, stop all medicines. We don't need these medicines. That cannot happen, actually. So it's because of lack of education as well. And as I said, my message, honestly, to all the women and men in Pakistan is that this is something which is treatable. So if you are having, and through the doctors as well, if your patient is having fever, it's not being diagnosed, if you find somebody has renal failure, if you're finding somebody has low blood counts, if you find somebody has seizures, so please make sure you're not missing this diagnosis. And for the patients, please don't leave your medications. Please continue in touch with your physician and the lupus specialist. But the most important thing is this, yes, it is genetic, and our marriages in our country are cousin marriages some of the time. And so we're soon going to start research on this with inshallah, with
between consanguinity and lupus disease. Because if it does run in families, and there can be a tendency, if you marry within your family, then you are effectively doubling your chances of having lupus.
25% more chance. So this is why it is so very important that if you have, these cousin marriages, people who have autoimmune diseases, I keep on counseling my young, patients that make sure, you don't have cousin marriages, but there are family pressures sometimes. So, but there's a lot of need for educating the public. And I think I give credit to you for bringing this up. Very important topic, which is so, because, I just cannot, there's no other way you can.
No other way. No, they're quite right.
But
Yeah. Dr. Shakaib, I'm also wondering that because lupus is basically a lifelong condition, so it's a chronic condition, and I was reading statistics, again with the Lupus Foundation of America statistics, where 65% of people with lupus have said that they suffer from chronic pain, and 76% say that the fatigue caused by lupus has caused them to sort of stop socializing or just have reported a significant decrease in their social activity. And 89%, now this is in America, we don't have statistics for here, can't work full-time because of lupus complications. So clearly it's not just a matter of managing your symptoms on your own, but there's also like a social component to managing a chronic illness that I think in Pakistan, we aren't really aware of these chronic illnesses to begin with, but then there also clearly seems to be a need to understand what people with diseases like lupus need from the people around them. And that would include maybe, educational institutions, the workplace, so if, yeah. Don't want to hog the mic.
I think that's a very, very important question, and I'm glad you asked that because this is a component of lupus which probably people don't realize that it's a chronic, debilitating disease which can affect not only the patient but the whole family, as we were discussing the socioeconomic aspect of it. And so remember that it affects the younger age, and also where it's more of a age where you're more productive in your work.
Yeah.
And when it bogs you down, it impacts you psychologically.
Yes.
And when it impacts you psychologically, then it's a very high incidence of depression that the patient go into.
Yeah.
Because of several reasons we have discussed about. And the depression is something which most of the physicians or even the family can ignore because they can see everything else like a lupus rash, maybe a joint swelling, maybe ulcers in the mouth or nose, but they can appreciate what's going on in the mind of the patient.
Yes.
Here we have a young female who is about to get married or potentially is married and want to have kids, now has to go through this dilemma of taking the medications for the rest of her life, and at the same time be productive and also be receptive to the needs of the whole family, whether she's raising kids or something else. And that can cause depression, which itself can be pretty elusive and difficult to diagnose and difficult to appreciate many times. So that could be one of the major causes of fatigue. The medication side effects can be another major cause of fatigue. So those we have to remember that part. And aches and pains, most of the chronic problems can lead to chronic pain, which may be due to lupus, but may be due to a very common coexisting condition called fibromyalgia and depression.
Yes.
So pain may not only be coming from lupus. You have already controlled the lupus, but now you still have pains. Or either you have a side effect from, let's say, steroids and you have damage your hip, for example. And if not, it could be due to depression, or it could be due to the weight gain. It could be due to several other factors. And that's why holistic care, looking at the patient in totality, not just looking that, it's lupus, so it has to be just the joints involved. It can be multifactorial. And pain is mostly multifactorial. And fatigue can also be multifactorial. For example, anemia. Anemia itself can be of so many different causes, including lupus.
Yes.
So we have to really dig in. We have to take a proper history, physical exam, then arrive at a conclusion.
Quite right. And Doctor, do you feel like there's a stigma around acknowledging that you do have a lupus diagnosis? Is there a stigma there? That we can't sort of talk openly about the fact that, yes, I have an autoimmune condition, it's called lupus, and I might need extra days off work, or I might, need to, and again, I'm thinking about men and women, because we've talked a lot about women and babies and things, but if you're a woman who's past childbearing age, or if you're a man, then there are lots of life things to consider. So do you think that there is a stigma around it that prevents us from supporting
with young
people?
women? With young women, it is more. With young women, it is more, but not with adults that much. They get time off from work. They can. But with women, it is difficult, as I said, that, marriageable age, and they don't want to tell families that they have autoimmune disease or lupus. So it creates a lot of issues because they're getting married and the family doesn't know that she has lupus and she needs medication for the rest of the life, and she cannot, they can have recurrent abortions, which we forgot about. Actually, that's very traumatic, because why are they, so most of the time the recurrent abortions are because of an antibody, 3 or 4 of them, which can clot the blood and the blood supply to the fetus. So they don't want to tell people that they have this autoimmune disease, because everybody can Google and find out, that's going to be an issue with pregnancy, there's going to be an issue with recurrent abortions, they have to take lifelong medication. So it's, in a way, it's a stigma for, but I haven't found issues with adults, men, or with adult women, whether they're affording, non-affording, they are okay with the diagnosis. So most of the dilemma is with young people and their children also, because women don't want to tell people that their child is suffering from lupus. But as I said,
for the same set of reasons. We don't want people judging and getting the wrong idea about things.
Yes.
It's disappointing, really. But thank you so much, Dr. Nigat and Dr. Shakaib, for being with me on the show today. I think for me, the crux of this show is that even if you have a diagnosis of lupus, you can have a healthy life. You can have a life that you can live to the fullest, as much as possible. But you do need support from the people around you. You need support from your family, from your loved ones, from the person that you marry, the people that you work with, because a chronic condition is something that you have to live with for the rest of your life. And it's something that if we are able to have honest conversations about our needs and our situations, A, we will sort of feel less alone in the world, and B, we will make a more inclusive society for all of us, where there's space for everybody, regardless of whatever disease that they may be struggling with. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye.